What is a nasogastric tube? A nasogastric tube is a plastic tube inserted through the nose, past the throat, and down into the stomach. There are many reasons a patient may need a nasogastric tube. A nasogastric tube may be used for food placement and also to remove substances in the stomach. An NG tube is only meant to be used temporarily. It's not for long-term use.
How you doing, Mr. Doe? I'm Steve. I'm a student nurse. I'll be doing your NG tube placement. Is that okay? Super. Alright, you mind if I raise your bed up some? Alright, I'm gonna tell you a little bit about the procedure. The NG tube in your left nair. And we'll try to get you to participate and help out if you can by swallowing. If not, I got some water to assist. And then I might have you actually put your chin down to your chest or as far as you can get it so we can get it in there. Is that okay? Alright. Well, I'm gonna raise your back up a little bit. Raise you about 30 to 45 degrees. Alright, I'm gonna wash my hands. Alright. Right now I'm gonna get this tube, this NG tube, and I'm actually measure it. Make sure we get the right measurements before we go and sticking it in your nose. Alright. I'm gonna place the tip on your nose to your earlobe, down to the xiphoid process. That's all we want to go. Right now I'm gonna keep that spot. I'm gonna mark it with my marker. Now that I have it marked, I can actually put a piece of tape on it. This tape is going to tell me exactly where to stop. Alright. Now I have it taped. Put on some gloves. Move it up about 3 to 6 inches. I'm going to cover about 3 to 6 inches of ground. Before I stick it in, I'm going to check, make sure you don't have any obstruction. Check inside in your nose, make sure the nasal passage is clear, and also in the back of your throat. See anything? All right, now we can proceed. Are you ready? All right, here we go. All right. Try to swallow for me. Big swallow. All right, got some water right here. Sip on that. Excellent. It's going real smooth. Right, now I'm at my stopping point. Got it right where we want it to be. I have some tape. It's not the prettiest tape job, but it'll work. Include that other nostril, so I'm gonna move my tape. got a winner. Right. The best way to do this, check for placement, is the X-ray. Now I'm gonna also check your stomach contents. So I'm just gonna pull back, clamp it here and pull back. And now I'm gonna use my pH stripper, my strip tester, to check stomach contents. And it is within range. Excellent. Sir, we are done with your NG placement, NG tube placement. Let your bed back down. You want your head down, sir? So, head happy. And that's how you put in the NG tube.
With medication administration, you want to perform hand hygiene and gather all your supplies. You want to confirm the 5 medication administration rights: right patient, right dose, route, time, and medication. Confirm that the medication can be crushed. Not all medications can be crushed. These are the general categories of drugs that cannot be crushed. You have your enteric coated, long-acting, extended release, controlled release, sustained release. You want to put on some gloves, place your medication in the pill crusher. Crush the pill until you get a fine powder. Mix the finely crushed powder with 20 cc's of water at room temperature. Then you want to flush your nasogastric tube with 30 mL of water prior to giving the med. Then flush 5 to 10 mL in between meds. Finally, flush 30 to 60 mL after giving meds. Take your plunger off the syringe and connect the syringe to the NG tube. Pour your mixed medication into the syringe. You're done, then you can clean your pill crusher.